One of the key things that I think was a terrible mistake in messaging for the Democrats this fall is nobody said this. We already have a government-run system in this country. 50 million people are in it, and if you're over 65, you are one of them. That, of course, is not socialized medicine. It's like the Canadian system, which is not socialized medicine. It's a single payer. We already have socialized medicine in this country. About 25 million people are in it. It's called the Veterans Administration. Socialized medicine. And by the way, you know that people do surveys all the time about healthcare systems and what their customer satisfaction is? Kaiser is very, very high. You know what the highest rated healthcare system in America is by the people who are in it? It is the Veterans Administration, the socialized system, the highest rated system in America. There is another group of people who actually have a hybrid system, part of which is socialized medicine. They pay some money, and some of their insurance is a private insurance, but if they get sick, they can go to the company doctor, and for free. And they get their prescriptions, they come upstairs. If they get really sick, they go to a government-run hospital. Those people are members of the United States Congress. And so the question that we have to ask the American people is, if people over 65 have it, if the people who served valiantly to defend our country have it, and if the people we pay to make laws in Congress have it, how come we can't have the same choice they have, and that is a public option? Now, next, why is this? So this is important. It is not, as you know, 65% of the people in the most recent polls want to have that choice. The majority of Republicans think there ought to be a public option. I don't mean Republicans in Washington. I mean, if you ask somebody if they're Republican or Democrat, you do the poll, there's a majority of Republicans who think they ought to have a public option. Now, they're not going to sign up for a public option, but they believe, like most Americans, that choices should be made by us and our families. We know what's best for our families, so we ought to have those choices, not senators, not congresspeople, not the insurance industry, and not employers. That's what this fight is about. It is not the left versus the right, or Democrats versus Republicans. It is about the people versus the Congress of the United States, who are supposed to be serving us and not the health insurance industry. That is what this is about. And when you frame it like that, voila, people support and they get it.